Hyperthyroidism with infertility. First of all, what does the thyroid gland do? Yeah, we need to know that thyroid hormone plays a very crucial role in regulating metabolism, growth, and development by producing and releasing thyroid hormones. Yeah, and this primarily are T3 and T4. And T3 is it is called triiodothyronine, and T4 is thyroxine or thyroxine hormone. And this influence bodily functions, which include heart rate, body temperature, and digestive processes. Now, having said that, hyperthyroidism is an overreactive thyroid, meaning it is producing more of these T3 and T4 hormones than is required by the body. Yeah, and this can lead to infertility in both men and women. Yes, you heard me right, in both men and women. Yeah, primarily due to hormonal imbalances, of course, because the thyroid hormone is producing more than is required by the body. Yeah, so due to hormonal imbalances and disruptions in the menstrual cycle, especially for the women. So for the women, it can cause irregular periods, can cause difficulties with ovulation, it can bring about problems with implantation and pregnancy. Yeah. For men, it can decrease sperm count and sperm motility, affecting affecting fertility. Yeah, but fortunately, I need to mention this early enough. Fortunately, infertility related to hyperthyroidism is often reversible. It can be reversed with proper treatment of the thyroid condition. If hyperthyroidism has been detected early enough and promptly treated and properly treated, and then the reverse it can be reversible. This infertility that is related, that's why I'm repeating, that is related to hyperthyroidism can be reversed if proper treatment has been done. Yeah, so I mentioned by saying that in women it brings about menstrual irregularities. Yeah, it can cause menstrual cycle disruptions. Yeah, like amenorrhea. Just the other day we discussed about amenorrhea, and we said amenorrhea, it is a lack of periods. Completely, there is no period. You used to have it, they used to come, but no longer, not at all. It is absence, complete absence of periods. That's what we call amenorrhea, and that's just one of them disruptions this hyperthyroidism can bring about. It also brings about oligomenorrhea. Oligomenorrhea is what we call infrequent periods or irregular periods. Maybe it comes this month, but next month it doesn't, or it fails for like 2 months, and then the other month, the third month, it comes. Yes, and things to do with that. Also, it can bring about hypomenorrhea. Hypomenorrhea means light periods or periods that are less than used to. Maybe used to change pads like 3 times in a day. But right now, what you're having is you're using just one pad, and even that one pad is more than enough. You can understand what I mean by that. Yeah. So, we also mentioned that this hyperthyroidism can bring about ovulation problems, and the hormonal imbalances associated with the hyperthyroidism can interfere with the normal release of an egg from the ovary, which is ovulation. We discussed about this just the other day, Josie, making it difficult to conceive. Yeah. Just the other day, we discussed about ovulation, we discussed about implantation, and we discussed about fertilization and implantation. Yes. So I hope that is much more clear. It also brings about implantation issues. Yeah, so thyroid hormones play a role in the heart, in the health of the uterine lining, which we call endometrium. Endometrium is the inner lining of the uterus, which is crucial for successful implantation of a fertilized egg. Just like we discussed the other day, yeah, we said that fertilization takes place. Fertilization takes place in one of the fallopian tubes, yeah, and then once fertilization has happened in the fallopian tubes, it forms a zygote. This zygote travels down to the fallopian tube. Yeah, just a recap, a short one. It travels down to the fallopian tube where it becomes a morula. Yeah. So once it reaches the uterus, the morula becomes a blastocyst. Now this blastocyst that is in the uterus already burrows itself. Yeah. It attaches itself into the uterine lining, which is we are calling the endometrium. And this is what we call the implantation process. Yeah. So this can be disrupted by this hyperthyroidism. Can you imagine? Yeah, failing. So meaning the if implantation does not take place, then there's no baby that grows. Yeah. So we also need to mention that there are also complications that comes with pregnancy. Yeah, with the untreated hyperthyroidism during pregnancy. It can increase the risk of miscarriages, preterm birth, and other complications for both mother and the baby. Yeah, and for the mother, it can bring about miscarriages, preeclampsia, preterm labor. That means for the preeclampsia, it is a high blood pressure before the birth of the baby. Then the preterm labor. This means that this is a true labor that comes about before the baby is term, and we call a term baby from the age of 38 weeks all the way to 42. Yes, so to 42 weeks. So if it can bring about preterm labor. Also, it can bring about thyroid storm, what we also call thyrotoxic crisis or thyroid crisis. These are very high levels of thyroid uh, complications, and then heart failure. It also brings about heart failure to this unborn baby. Yeah, it can bring about fetal tachycardia, also low birth weight. I may need to explain a little bit about this low birth weight. This low birth weight comes about due to intrauterine growth restriction. This what we call IUGR or intrauterine growth restriction is where the baby cannot is the baby's growth is restricted. It cannot grow beyond a certain weight. Yeah. Yes. Also, this baby can be born prematurely. There can be stillbirth. It can also bring about congenital malformations. Yeah, what we call birth defects. These birth defects are structural, can be structural or functional. Yeah, abnormalities that occur during fetal development and are present. They are usually present at birth. Yeah. Yeah, there's also this treatment and management for hyperthyroidism, and we usually use what we call THRT, thyroid hormone replacement therapy. And in most cases, treatment for hyperthyroidism often with antithyroid medications, radioactive, iodine, or surgery can restore thyroid hormone levels to normal, what we call euthyroid state. Yeah. Also, the reversal of infertility. Once the thyroid condition is under control, fertility often improves. That I mentioned, and I just mentioned it again. So monitoring during pregnancy is very important. So if hyperthyroidism is present during pregnancy, it's crucial to work closely with both an endocrinologist and an obstetrician to manage the condition and minimize the risks, yeah, to the mother and the baby. Thank you.